medical doctors in Malaysia. So I hope we can have a discussion after that. So during this 20 minutes or so, the lecture content of my will be, I just give some small introduction into medical education in Malaysia. And I just like to start off by relating to the Medical Act 1971, which was amended in 2002, but which has been gazetted in July 2017, has taken into force in July 2017, because it will affect the pathways to postgraduate program. Then I'll just go through the pathways to postgraduate program from traditionally into what is current and conclude from that. Do you know that medical education is an important in terms of producing qualified or highly competent, in this case, in our setup, is they will work as a houseman or intern first. But when you produce a highly competent house officer and interns, and this will become an enabler for them to enter postgraduate qualification. And we hope by 2030, WHO has produced its SDG in terms of medical education. By 2030, we hope that we will follow suit and produce highly skilled specialists to meet this SDG. And I think this SDG, which is stated by WHO, is an important global strategy for human resource for health. And it's important for us to remember that. So one of the things that's important in terms of medical education to meet this is to firm our standards in medical education. And in this case, we're talking about postgraduate pathways. So we want to focus on standards in specialist medical education, which focuses on EPA, and this is enhanced professional activities, where it also will enhance the competency of the healthcare providers in providing specialist care. So to achieve this, when we should have a universal standards in terms of specialist education for both public and private programs in our country, there shouldn't be any disparity of standards, and they should be followed. So it's also good to have a standardized curriculum. So we have a standardized based assessment, standardized facilities, hopefully, and having adequate resources to produce all these highly competent specialists. And of course, we should also have highly competent teachers, and in a way of having standardized competency. And of course, student, there must be some flexibility. So let me just give some background in medical education in our country. So in Malaysia, we have the Education Act, which was in 1996, and the National Accrediting Board was first established in 1996. So initially, before 2001, all the medical school, which was already established in public universities by then, have been recognized by a panel of assessors appointed by the Malaysian Medical Council. But once the accreditation body is established, then the medical programs, in the public and private universities, then has to be subjected to accreditation system, which was established in 2001. And in our country, medical programs are provided both in the public and private university. Having said that, they have to accreditation is very important. Accreditation is in medical school in our country is still voluntary. Now, we have the Medical Act 1971, which was amended in 2012, but it was only gazetted in 2017. So by July 2017, because of the Medical Act has been gazetted, so we would have to follow the Medical Act, which I will state in a while. So when you look at this Medical Act, I'm just going to highlight some important things first. So in this Medical Act, which is fully enforced in July 2017, so if I quote and read, so under this, a person entitled to registration as a specialist in our country, and I put the original version on your right side of the screen, but I have transcribed it. So under the item 14B, it states that a person is entitled to be registered as a specialist under this act So meaning in Malaysia, if they must comply to all these 4 criteria. A, he has been fully registered under Section 14. That is registered in Malaysia in the MMCA. And he has attended B, specialized training in the specialty in a recognized training institution. So the word is recognized training institution, such as applicable in our country. C, and he holds a recognized specialist qualification. So this come together. So recognized institution and recognized specialist qualification. And D, he has proven to the satisfaction of the council that he is fit and is of good character and to be registered as in this National Specialist Register. So if you look at under this act, also under the item Medical Education Committee under subsection 22, so if you look at number 3D, so this Medical Education Committee will be the one responsible also for the standard and qualification of entry into the specialist register. Now, if you Google into the Medical Nation Council website currently, and I just made that Googling yesterday, so you'll find that if it takes you to the National Specialist Register, so it's this code in the bottom that says code, the Medical Act 1971, amended 2012, and the Medical Regulation 2017 come into force the 1st July 2017. The Act provides that all doctors must be registered under this Act to practice as a specialist and to ensure that they meet the necessary qualification and the standards by the MMC. So this is something we have to remember because now to be deemed as a specialist, working as a specialist in Malaysia must confine to this medical act, and it is compulsory. Now, having put that as an intro, so let's just look at the postgraduate pathways in Malaysia. So traditionally, in Malaysia, the postgraduate pathway is via public or private universities. So they can be provided either by the local master's program or the PhD program. When you look at the history of postgraduate program in Malaysia, it actually started way in 1973 when and all this program currently in our country, all the local masters and PhD, they are accredited program. They are listed. They have been listed to the MOFI, the Higher Education Authority, and also in the MQA. So they are considered accredited program. So all these programs, they are listed or they are accredited program will then be listed in the Malaysian Qualification Register, which is the MQR. And you can go into the Malaysian Qualification Register to check which qualification is approved and listed and accredited in our country. Now, this is important because in terms of employment later. So you can also go to the registrable, to the NSR page to look at the registrable to how you can register to the National Specialist Register. Because it's important as specialists now you have to have NSR. Because this is a legal requirement, then it can be a problem if a specialist practicing in a specialist domain but do not have the NSR. So therefore, if you look at this in terms of requirement, and of course, it would be recommended that all aspiring doctors in Malaysia in the easiest and safest pathway is to enter this pathway of postgraduate qualification provided by the local master's program or the PhD program, which is recognized or accredited in our country. But here, just let me just say about the MQR. So MQR is very important. That's where the qualification is registered in the Malaysian Qualifying Register. You can just check any qualification. If it is listed there, then it is recognized. So it's important for government employment especially, because for the government, they will look at the MQR as reference for employing a particular person. So if a degree is not listed in MQR, then it may jeopardize employment. The other postgraduate pathway, which has been with us for many years, is going by a postgraduate pathway provided by international programs. But these programs are not accredited in Malaysia because the parent body are not registered in MOHI. But there are some postgraduate pathways, especially like if you look at accountancy, they're provided by international program, but they are listed or they have get clearance or been accredited by the MQA. So they are then accredited program in our country. But in medical, the postgraduate pathway provided by international programs currently are not accredited in Malaysia. So for example, previously you can go for MRCP or MRCOG, FRCS and extra. There's so many other programs that our doctors have been. So previously, then they would be able to get NSR registered. So after the Act came into force in 2017, because in the Act, there is no provision in the Act to sort of recognize a foreign program unless that foreign program is listed or has registered in MOHI and has been accredited by MQA, then only it will apply into accreditation. So we are not able to recognize the international program. So what happens? So all the postgraduate qualification before the Medical Act came into force, which is in July 2017, now becomes an administrative adopted list. So these doctors, so they're still safe, then they are already registered under the NSR, so they still can perform as a specialist. But however, it's still been a contentious area. We do not know the legal position, but these people before the 2017 and now all will probably not in jeopardy, but we do not know what's the future hold. But what happens after July 2017? So after July 2017, when the Medical Act is enforced, so there is technically no such list. So if in a PG qualifications international programs, if you have a qualification in international program, subsequently, then you would have to be subjected to an equivalency process. So what is an equivalency process? It's where the process is for the recognition of an individual with that qualification. Well, we can recognize these people as an equivalency process when they possess this qualification, but it still remains a legal debate. What will happen in future? So it's still a contentious issue. So it's still debated currently. So we're still not sure what the future holds. So that's the best and safest way to go for accredited program. If for those who aspires to go in postgraduate pathways. So how can an international program then be subjected to accreditation? So well, they would have to apply for registration with the MOHI and subject to accreditation. Then it will become easier. But for the time being, there are some programs that are looking into that route. But for the time being, the safest and best way for postgraduate pathway currently would still be the local program. The local postgraduate program, either the master's program or the PhD program. There are currently more than 29 programs in the master program. There are various things in the program, so which you can look up at the also at the website. Now, what are other pathways that's available? There's some aspiring young doctors may want to pursue postgraduate pathway directly to the country in question. For example, if you want to do a MRCOG or MRCP, you go to UK and do completely the program there from entry into the program and completion of the program, and you now obtain qualification as a specialist in that program, which is recognized in that country. So now you are a specialist in that parent country. So if you come back to Malaysia, would you be recognized as a specialist in Malaysia? So that is still uncertain whether or not now we could do that, but it still would subject to equivalency. So it still remains a contentious issue, and it still remains something that's debatable. So there are some people who are in this particular pathway. So they are recognized in the parent country as specialists. When they come back, what will happen? So So how we define what does it mean in terms of parallel pathway or parallel program that's currently in our country? When we say parallel pathway, it's meaning the training of the postgraduate program is being done in Malaysia, but the exam is taken in the parent country and they get the qualification. So is it something that it's recognized here again currently after 2017 and it becomes not recognized, and would it be subjected to equivalency? Probably it would be. So, but and how about, so in terms of legal, so would they get into NSR? Something that's still debatable and contentious issue at the moment. So what about para program? So para program is a training being done in Malaysia and the exam is taken in the parent country. So so the para pathway, where the difference is the exam is taken in the country, but the parent program is the exam is taken in the parent country. So again, it's the same. So the question is whether that program, if you take that particular program, whether your qualification would be recognized in the parent country. So if it is recognized in the parent country as a specialist, now would it be recognized in our country? So after this act in 2017, this is something that is still being discussed, debated, and still has legal implication. So in future, so it still become a contentious, uncertain issue. So that is how it is currently. So when you look at, so if you in the young doctors who aspire to enter the postgraduate program in a country, then you have to look at the entry requirement into this specialty program. So in 2019, the Malaysian Medical Council has published the Malaysian Standards for Medical Specialist Training. As I said at the start, it is good to have a standardized program, standardized, and we also have a standards for medical specialist training, which before we do not have. But now we have a Malaysian Standards for Medical Specialist Training, which has been published. But you also have specialty standards, because this is a generic standards for every program, every postgraduate program in Malaysia. But there are also specialty standards, which has to be read together with the medical specialist training standards. So currently, we are going through all the standards of the specialty standards. There are many, many programs, postgraduate programs, so we're trying to come up with a standardized standard. So if you aspire to enter this program and you want to know what is the requirement, then you can go to their website or you can ask the fraternity themselves what the requirements. Currently, I think the MMC has published, I've just accessed this yesterday to see whether it's current. So currently, the MMC has published the specialty-specific requirements for 5 programs which has been approved by the council, which is the family medicine, the clinical oncology, genetic pathology, plastic surgery, public health medicine. So these are the ones that's already been approved. So in general, the generic standards for all postgraduate programs in our country currently, there must be a minimum of 48 months and have in some specialty, they have slightly longer training period, but the minimum must be 48 months, and that is the same for all. The only there might be some difference in terms of entry criteria, which you can look up in the specialty specific requirement in preparation for you to enter this program. So in conclusion, so I think with the Medical Act 1971 coming into force in July 2017, where the safest and the best pathway for all aspiring postgraduate students is to go for our local accredited program, then you would have no issue in terms of registration into the NSR and becoming a specialist. So once you have got that, and you want an additional PG qualification from international program as a secondary qualification, yes, of course, that can be done subsequently. Now, whether or not we should encourage people to go other programs like what we did before is something that probably now, for the time being now, I would say that the safest and best program pathways for all aspiring doctors is still the local accredited programs. And I thank you for your listening.
Thank you very much, Prof. Jamie. That was a very clear and very enlightening talk. I would like to introduce our next speaker, Prof. Harmi. Prof. Harmi bin Muhammad Yusof is the Dean of Medicine at University Zainal Abidin Unisa. He is a former Conjoint Part member for Family Medicine Specialist Training. Now, with key roles in academia and multiple awards, he will offer valuable insights into the family medicine career pathway. So without further ado, Prof. Harmi, the floor is yours. For the participants, you may ask questions, you may drop your questions in the chat box, yeah? We will keep a lookout for it and answer at the end. Thank you. Prof. Harmi, thank you.
Thank you very much. Can you all hear me?
Yes,
Hello?
Prof.
Okay,
Yes, Prof.
okay. Okay, can we? Okay, thank you very much, Dr. Nojahan, and thank you to also to the panelists, Prof. Jamia, as well as Dr. Prof. Chandra Mani from the academy. And I'm very glad given an opportunity to talk about the career pathway in family medicine. And my topic, I will just focus on our postgraduate local program, Master in Family Medicine, because there are the panelists. The Prof. Chandra will talk about the parallel program, perhaps focus on the ATFM. So as we know that the number of family medicine in our country is not reached to the ideal. So according to our former DG, so we need about 8,000 family medicine. So at this moment, we only have around 800 family medicine in KKM, and if I add another 300 from other institution like university, so or private, so total we only have around 1,002 family medicine specialists around country. And the needs is compounded by one issue of a deficit number of family medicine in our country. Second, the population growth. That's why when the KKM calculated that we need 8,000 family medicine, that about 3 or 4 years ago. Now when I calculated again, based on the population, so we need around 8,500 family medicine specialists. This is based on if you look at the population growth in 2022, we only have 33 million, but now we have more than 34 million population. Does not include the immigrant plus the illegal immigrant. Immigrant we have around 2.5 to 3 million. When we add the illegal immigrant, it might be close to 4 million population in our country. Okay, next slide. Next slide, please. So this this number actually based on the calculation at 1 to 10,000 ratio, population ratio between FMS and population. So if we calculated in 2025, we actually have a deficit of 2,500 FMS. And in 2030, it close to 3,000 deficit. This based on 1 to 9,000 ratio population. If you use a 1 to 4,000 population, the number will be higher. Okay? And when we calculated, this is the projection of the specialists needed in our country. So the number of specialists needed, the highest is actually in family medicine, although the critical one in anesthesiology and critical care, but in terms of number, family medicine is most needed specialist in our country. Okay, next. This is the growth of FMS. This figure focuses on FMS in MOH. If you look at here, So we only double the number of FMS in KKM every 5 years. For example, in 2013, we have 228 FMS, and then it only doubled in 2018, and again, it doubled in 2023. At this moment, we have about 814 FMS in MOH, plus another 300 FMS in other places like university, other agency, or private. Okay, next. And at this moment, only 6 universities are offering Master in Family Medicine, which are University Malaya. University Malaya started in, I think, in 1989, and then followed by UKM in 1992, and after that, USM. At this moment, we have 6, including UPM, IIUM, as well as UITM. And then this is a 4 years program. And then it is, at this moment, it is at the level 7. We at the Dean Council now working very hard to uplift this postgraduate local program as a level 8 program. We pray that this one can be materialized soon. Okay, next. As mentioned, Prof. Jamia just now, the importance of having a single standard of a curriculum. That's why I think together with other institutions, work very hard in coming out with a national curriculum for our postgraduate training. And the rest of my presentation, I will refer to this document, the Primary Care Medicine Postgraduate Training in Malaysia, version 1, 2021. So you all, if those interested to join a family medicine, perhaps can look into this material, so then you can understand the expectation of the program. Okay, next. I will talk on the entry requirement. Here there are 2 entry requirements for MMed and ATFM. However, I just focus on the our local master program and med program. Because of the other panelists, perhaps we'll talk on the parallel program. So the first requirement, of course, we need the MBBS or other medical qualification which are recognized by the MMC. This is a mandatory. You need to issue the original certificate and transcript when you apply this for this program. And of course, you need to have a full registration with MMC. Please provide the full registration certificate as well as your current APC. And then full registration clinical experience. These are different for each university. For example, 1 year requirement is needed for UKM, UITM, and UIA. 2 years experience by USM, and UPM required longer exposure to clinic for primary medicine, about 3 years exposure. Okay, next. Okay, and for the clinical experience, they are the area that you need to report to us. For example, during your housemanship, you need to undergo the rotation of internal medicine, pediatric, ONG, and then the optional one, like a family medicine or primary care posting, general surgery, as well as a psychiatry. That one is an option. So you need to provide to the panels of interview the exposure that you have. And of course, in terms of evidence, we will ask you to get the report from the clinical posting, every posting that you gone through. And then another one is we introduced what we call it the essential learning activities, ELA, where you need to provide the evidence of reflective journal of ELA during the interview, and associated work-based assessment. For example, case-based discussion, or direct observed procedures. And these are the documents that are required during the interview. Of course, the personal qualities. And you need to write a reflective note on the specific personal qualities, which I will elaborate further later. Okay. Next. These are the desirable qualities that we want. If you attended courses, workshop, which are relevant to family medicine, it become a plus point. And another things, if you can do the audit, clinical audit in your workplace, for example, in KK and so on. So you can also bring the full report of the audit during the interview because it will be counted as extra point for you. Or if you involved with the presentation, poster exhibition, publication, so it can be also the plus point. Of course, if you come from the from overseas, so there's a English requirement. This is, I think, actually fixed by the our KPT. You need to have a minimum of IELTS band 6 and TOEFL 600. And for a private applicant, for example, those who come from general practitioner or other institutions, they also required to have the same requirement. There's no difference in terms of the requirements. Okay, next. And before you be accepted to the program, so you need to take the MEDEC exam, and you need to get band 4 and above. And after that, it is not necessary warrant the place. You need to compete with other friends. For example, if we only have 100 or 120 places, then we will choose the highest one based on the merit. So you also need to pass the interview. And normally, we conducted the interview conjointly together with all 6 universities. And then each university can choose you, although you might apply a USM, but you can also be negotiate to join, or they might negotiate you to join the other university. That also based during interview. And unfortunately, normally between 100 to 120 places will be offered for this program. Okay, next. These are the example of essential learning activities. These are the professional activities which a trainee can demonstrate to the acceptable level of competency. So we have 11 ELA. I will describe later. Then you need to have some level of competency, and you have to prove it during the interview. The applicant also need to submit the workplace assessment, for example, CBD, case-based discussion, and short reflective note for each ELA, as I mentioned earlier. Okay, next. These are the example of ELA. For example, ELA 1 is about take a focus history. ELA 2, perform a good physical examination. ELA 3, generate differential diagnosis and probable diagnosis. ELA 4, recommended and interpret common diagnostic investigation. These are the things that you need to report through a reflective journal. So then you can also be assessed during the interview about this ELA. And those who show a certain level of expertise competency will be selected to the program. Okay, next. This is about personal quality that I mentioned earlier. For example, motivation. You have to provide an example what motivates you to join the program, or what motivates you to work in a primary care. Self-learning, what for example, what you learn from reading certain books or journals, you have to write that. Reflection, for example, how do you manage the case, how the decision made, for example, how things happen which might change the practices. These are the example of personal qualities that you need to report. For example, working under stress, you can write how you work, for example, during the COVID pandemic and so on. Next. So normally the process, we have basically two type of applicant. One, the traditional one is come from the KKM. So you need to apply from the Ministry of Health through a sistem permohonan hadiah latihan persekutuan HLP. You can refer to the EHLP MOH GOV My. So you can see that there is a process how to apply for the HLP. And then if you are not from the Ministry of Health, for example, if you are a trainee lecturer of certain university, or you come from the Ministry of Defense, then you can, for example, directly apply to the university of choice. For example, if you're interested to study in UM, then you can directly apply to UM. If you want to pursue in USM, then you have to contact USM to get the information how the process like. Okay, and before that, previous slide. Then after that, we will call for the, ideally you should have your MEDEC first. So then during the interview, you can show the MEDEC results as well as the document that I mentioned earlier. Okay, next. And some university, for the direct application, they might not, you might escape the interview. That depend on the university. Some university, they might not interview you. They just based on the requirement that need to be passed to them before you can be accepted to the program. But the KKM candidate need to undergo all the interview that I mentioned earlier. These are the example website for KKM. So you can see the process before finally you can be accepted. For example, for this year, so we supposed to get the application by now, by now. And then tarikh sokongan ketua jabatan terakhir on the 16 October 2023. Okay, next. This is iklan tawaran hadiah latihan belajar. Okay, next. So I just give you overview about the program. Normally, we have all university have three phases. Phase 1 consists of year 1, and phase 2 consists of year 2 and year 3, and finally phase 3 is actually at the year 4. So in the beginning of year 1, normally you have a series of placement, a rotation to hospital rotation. So it includes the major discipline as well as the minor one. I will show you later the sample of USM. So in phase 2, so you continue the rotation in a small minor posting plus a primary care posting. And normally after you pass the part 2 examination, you will go to phase 3. And in final year, you are working as a shadow to a senior family medicine specialist. So you will be posted in any clinic kesihatan in Malaysia. Okay, next. So these are the example of curriculum structure. I use a USM. Different university might have a different structure, but more or less the same in terms of the exposure to every discipline, but the duration might be different. In USM, for example, so the medical posting about 22 weeks, followed by pediatric and ONG 11 weeks each. The rest you will be having an intensive course and professional examination. So in year 2, these are the example of the rotation: dermatology, ophthalmology, ENT, surgery, behavioral science, office orthopedic, A&E, and another compulsory course like ultrasound skill training and so on. And there is a short exposure to a primary care. Okay, next. In year 3, there is a research preparation dedicated given to you, elective, intensive course, and main bulk is actually on the primary care posting, about 36 weeks before you subjected to professional 2 exam. And in final year, basically you will be in year 4, you will be posted to healthcare center, KK Kesihatan Kelantan for the rest of the posting, about 44 weeks. You are also given time for the research writing and certain intensive course before you finally subjected to the final exam or Pro 2 exam. Okay, next. After you completed your study, then you need to be registered to NSR, as mentioned by Prof. Jami. This is a requirement. And at this moment, we have 6 programs that allow to be registered to NSR, which are Master of Medicine, Master of Family Medicine, UM, Master of Doctor of Family Medicine, UKM, previously named as a Master of Medicine until 2012. But although the name is Doctor of Family Medicine, but they are still at the level 7. Master of Medicine, USM, UITM, UPM, and IIUM. And after that, you need to undergo the gazettement process about 6 months, but you can only be registered to NSR after you completed after 1 year. After 1 year, only you will be registered to NSR. Okay, next. This is the career pathway USF FMS. So at this moment, this is the subspecialty program, or we also call it as an area of interest, an area of special interest. At this moment, we have 13 subspecialty training, including community health, geriatric addiction in primary care, child health in primary care, sexual reproductive, infectious disease, NCD, adolescent health, palliative in primary care, child with special need, and community-based rehab. At this moment in KKM, they have about 64 FMS undergone this process. 32 already completed, another 32 is in training. So in university, I think the similar things happen. Some of us do their area of special interest in this area as well. Okay, next. I think that's about all. I just end my presentation with this quote. This is the philosophy of family medicine, where you not just focus on the disease, but you also put the patient as your important. So the good physician treats the disease, the great physician treats the patient who has the disease. So thank you very much.
Thank you so much, Prof. Harmi. That was very thorough and enlightening. Our next speaker is Professor Dr. Chandramani Thuraisingam. She's a family physician and is currently the head of Department of Family Medicine in IMU. She holds a master's in health professions education and is a fellow of both the Academy of Family Physicians of Malaysia and the Royal College of General Practitioners. So she will be highlighting the pathway for us in the parallel pathway, I think. Yes. Right. Thank you, Dr. Chandramani. The floor is yours.
Thank you very much for the kind introduction. A very good morning. My name is Chandramani Thuraisingam, and I am from the International Medical University. Thank you, Prof. Jamie and Prof. Harmi, for your insightful presentations. You have certainly made my job much easier this morning. Family medicine is also known as primary care medicine. I want to start by saying that the scope of a family doctor's practice is generalist medicine. Generalism, you could say, is the specialty of family doctors because we see a diverse case mix. This helps us to build our knowledge base, and this is associated with improved patient outcomes and increased efficiency of the healthcare system. Family medicine, in contrast, is a specialty of the family doctor. It 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 is a specialty of the family can be distinguished from other aspects of the healthcare delivery system. Family medicine, in contrast to specialty care, is associated with a more equitable distribution of health in populations. Family medicine has improved overall health and reduced differences in health across major population subgroups. Family medicine is about relationships. It is the scope of practice that helps family physicians build the revered doctor-patient relationship, which is something that is unique about our identity as family physicians. So, how is family medicine different from internal medicine? Family medicine deals with patients of all ages, children, adults, and the elderly. And while internal medicine focuses on the treatment of adults. Family medicine mostly deals with ambulatory patients, and while internal medicine mostly deals with hospitalized patients. I would like to pay tribute to this important person, Professor Barbara Starfield, a distinguished professor of health policy and pediatrics at the Johns Hopkins University. She is internationally known today for her seminal work in primary care and her 4 C's framework of primary care. Today, these 4 C's are certainly the essence of good management of chronic non-communicable disease, which has become not only an important global and national problem, but also an individual health concern for all of us. Later on, however, 4 P's came to be added on to Barbara Starfield's 4 C's of family medicine, namely primary or first level contact care, personalized care, patient-centered care, and preventive care. This is what the American Association of Family Physicians had to say about family medicine. Unlike other specialties that are limited to a particular organ or disease, family physicians are the only specialists qualified to treat most ailments and provide comprehensive health care for people of all ages, from newborn to seniors. As has already been mentioned by the speakers before me, there are 2 main specialist career pathways in family medicine in Malaysia. The master's pathway and the 2 parallel pathways. The master's program is conducted by the 6 public universities in Malaysia, as has already been mentioned. And there are 2 parallel pathways in family medicine specialization in Malaysia. They are the conjoined MAFP International Conjoint FRACGP, awarded by the Academy of Family Physicians of Malaysia, which utilizes the curriculum of the Royal Australian College of General Practitioners, or the RACGP, and the MICGP MINT FM program, which utilizes the curriculum of the Irish College of General Practitioners. I would like to say here that we also use the curriculum of the National Postgraduate Curriculum, and I'll show you that later in my slide. Today, I will speak about one of the two parallel pathways to specialization in family medicine, namely the conjoint MAFP-ICFR-ACGP. The Academy of Family Physicians of Malaysia is the training provider for the conjoint MAFP-ICFR-ACGP. The conjoint program is a stakeholder in the primary care medicine training program in Malaysia and upholds the required standards in this national curriculum. So our curriculum is based on the national primary care curriculum. These are the entry requirements. You must be a medical practitioner, fully registered with MMC and practicing in Malaysia. You must have at least 1 year working experience as a medical officer or a GP. You must be in full-time primary care general practice or its fully recognized equivalent at the time of application. You must remain in full-time primary care or general practice or its fully recognized equivalent throughout the program. You must possess a current and valid annual practicing certificate. You must apply to be an associate or ordinary member in benefit or a life member of the AFPM, which is the Academy of Family Physicians of Malaysia. And the application must be approved by the AFPM Board of Censors, which reserves the right to reject any application. For the KKM medical officers, you can start with your application when you are in the first year of medical officership. For the doctors in GP practice, you can apply anytime if they have fulfilled all criteria. For more information, kindly refer to the Academy's website and to the AFPM Postgraduate Course Guidelines and Policy at this URL. This is an overview of the Academy's program. In the first 2 years, you do the GCFM or the Graduate Certificate in Family Medicine. On passing the GCFM exam, you move on to the ATFM or the Advanced Training in Family Medicine program for the next 2 years. In the ATFM program, you have to pass the eligibility exam before you can sit for the Part 1 and the Part 2 exams. All these examinations are taken in Malaysia and the training is carried out in Malaysia. So in summary, the Academy's program is a 4-year structured academic program with research, encompasses strategic collaboration with the Royal Australian College of General Practitioners or the RACGP, prepares general practitioners in Malaysia for the conjoint MAFP in ICFR-ACGP examination with the objective of producing doctors for unsupervised safe general practice. And after successfully passing the Part 1 and Part 2 examinations, trainees need to apply with requirements of RACGP before being awarded the MAFP ICFRACGP qualification. On being awarded the MAFP ICFRACGP qualification, you will be recognized as a family medicine specialist and will be registrable with the National Specialist Register of Malaysia following a compulsory period of credentialing. The conjoined MAFP ICFRACGP parallel pathway in family medicine is registrable with the National Specialist Register of Malaysia following a compulsory period of credentialing. The Academy's program is unique. All teaching and learning activity is conducted during the weekends only. GPs and KKM medical officers can continue to go on working where they are currently located in their clinics, while upskilling themselves to become family medicine specialists. Two scholarships are awarded to deserving candidates. The first one is the HLP by the BPKK, which is awarded to Bumiputra KKM medical officers. Please refer to their website. The second one is by Yayasan Peneraju, which is awarded to candidates who are 45 years and below. This scholarship is awarded to Bumiputras and recently also to non-Bumiputra candidates. Please also refer to their Facebook page. There is a real need for family medicine specialists due to the serious shortage in Malaysia. Malaysia requires an additional 8,000 family medicine specialists to meet its target ratio of 1 FMS per 4,000 population. There is definitely now a call for more doctors to take up and specialize in family medicine in Malaysia. So think hard and choose right. Make family medicine your choice. Thank you. Thank you.
Thank you so much, Prof. Chandra. That was very enlightening, and thank you for reminding us the important role of family medicine, which is caring for the community from womb to tomb. And thank you also for sharing the parallel pathway journey. So I would like to invite all the three speakers to on the cameras, and we are ready for Q&A. Are there any questions from the floor? If not, I will just read out one of the questions in the chat box. This question is from Mr. Kelvin T. He says, good morning. He would like to know how hard or easy it is to become a specialist in Malaysia. How competitive is it? Usually how many doctors will be absorbed into the local programs? So this question is open. Perhaps Prof. Jamie, you would like to start, and then Prof. Chandra and Prof. Hami can chip in later.
Thank you very much. If you notice what Prof. Hami said just now, we need a lot of specialists, so of course it will be competitive. Definitely competitive. So we want the best of the best, but it doesn't mean that you cannot go in. It depends on your specialty that you want to apply to. Some will have a bigger intake, some will have a smaller intake. So for example, in the master's program for ONG, currently there are 4 universities having that program, and UITM will join pretty soon. So currently is UKM, USM, and UIA, and you will now include UITM. So the The MOH aspire to at least produce more than like 150 OBGYN specialists per year. So every university, if you look at it, will be able to take like 25 to 30 as new applicants, depending on that capacity at that university. Because as what we said just now, the program must be standardized, facilities must be standardized, resources must be standardized. Sometimes they are limited by facilities, limited by resources, limited by trainers. So they want to take a lot, but they are unable to take it. So of course, it will be competitive. How difficult it is? Well, I think I don't have for me to say it's not difficult if you follow the program. You have 4 years to become a specialist. So difficult is one person um, perception. So specialist, you would expect it to be difficult.
Thank you, Prof. Jamie. Prof. Harmi and Prof. Chandra, do you have anything to add?
Okay, thank you for the question. For the family medicine, so we have the application around 300 to 400 every year. And finally, the one that we accepted to the program is only about 100, and the most about 122. It shows how competitive they are compared to 20 years ago when I joined the program. At that time, the place is more than the application. So you are very certain that when you apply, you will got the place. But now, sometimes can 3 or 4 times you need to apply before you can be accepted to the place. So the tip is actually you need to have the qualities that we want before joins the program. As I mentioned earlier, there are a few things that now we are scrutinized in terms of the essential learning activities that I mentioned earlier, the personal qualities and so on. So if you're interested to join the program, you must make sure that you exposed to the specialty that you want. For example, in family medicine, if you are exposed to family medicine posting, then you are given plus point, and you show the competency and qualities that we want. I think with that, the chances for you to be accepted to the program is higher. Okay, thank you.
Yeah, I think I would agree with everything that Prof. Jamie and Prof. Harmi said. Um, I think it's a lot of hard work, and as long as you have fulfilled the criteria to come into the program, then it's a lot of hard work, but the rewards are great. Thank you.
Much. We still have a few more questions. Aiman is asking, he says, thank you for the insightful session. May I ask how different it is between master pathway and parallel pathway in terms of competitiveness and flexibility? So I think this one, Prof. Harmi and Prof. Chandra, can you take turns answering? Maybe Prof. Chandra first for the parallel pathway and then Prof. Harmi for the master's pathway.
Prof. Harmi, would you like to go first?
Okay. Okay, for the master program, as compared to parallel program, we are more structured. And then at this moment, the program is not that flexible. But at the Dean Council as well as KPT, now we are looking to more flexible program, so then more people can join us. That's our way forward. We try to make sure that the program become the master program, not necessarily the family medicine, but the other program is more flexible. So then we can receive more candidates, especially from KKM, without compromising their services. But of course, at this moment, there are few methods of postgraduate program, the master program. Some of them need to be in the university, but the rest still can be done outside the university where you are still in the KKM facilities. It allows some flexibilities in terms of moving from your current places to the training places. So although it is not as flexible as parallel, pathway, but I think it gives you some choices in terms of the flexibility of the program. But we are in the process of designing more flexible entrance requirement as well as the training structure. Okay.
Thank you, Prof. Armi. I think I would like to reiterate also that we are flexible because by nature of the program, we only have our training mostly in the weekends, and we have many workshops through the 4 years. But we are structured, and we follow the national postgraduate curriculum in family medicine. We take in about 100 or so, but every year, but depending on whether they have fulfilled the eligibility criteria. So a lot more apply and a lot are put on hold until they have fulfilled the criteria. And all the criteria is actually on the website, so you can check it out under the AFPM policy guidelines. Thank you.
Very much. So moral of the story, there is some form of flexibility, is competitive, yes. But the idea is to build up your strength as you train in place, right? And have all the evidence. All right, there's a question via about scholarships. This is from, I don't have this person's name, but it's Galaxy. Hello, if one is keen to join the IFRA CGP, but via HLP scholarship, do we still have to go through the registration process via AFPM and also be a member? So I guess Prof. Chandra, this would probably
Yes,
be
I think you
your-
have to do both. Yes, you have to.
All right, thank you. And this is a question again regarding scholarship and being a contract MO, does it affect their entrance and acceptance into the postgraduate programs? So, and I think this one, anyone can take this, but
Okay, I think at this moment, the contract status does not bearing any bearing to the selection of the candidates lah. Basically, whether you are contract or permanent, we did not discriminate you. So we did not discriminate you. So if you can still apply, and the selection will be based on the criteria that I mentioned before. So no worries.
And I think the same applies to the parallel pathway as well. Yeah? There's no difference and no discrimination.
all right, thank you so much. And another one is, will students doing internship overseas be able to apply for the Master of Family Medicine in Malaysia? I think Prof. Harmi, this is probably up your alley.
Sorry again. What's the question?
Will students doing internship overseas be able to apply for Master of Family Medicine in Malaysia?
What do you mean by internship overseas? I think as long as it is registered to MMC, and you can have your APC, you are eligible to join the program. So if you do the internship overseas and then you come back and you can register with the MMC, I don't think it will cause any problem to you as long as it is registered.
And also you are Malaysian.
Sorry? Yeah.
So that means you are Malaysian. If you do your
Yeah,
internship,
I'm Malaysian.
your
I'm Malaysian.
internship in overseas, when you come back and you are registrable to the MMC, of course you can do. But you also have to be mindful when you do your internship in overseas, and some countries, the obstetric and gynecology are not compulsory. So when you come back, before you get your permanent registration, you would have to fulfill the obstetric and gynecology posting, and that's a requirement. Then only they will give you your full registration. Then after you get your full registration, of course, you can apply for the postgraduate program locally, having fulfilled all the criteria needed for all that particular specialty program.
That's true. Even overseas student, if they are recognized by us, they can also join our master program. We do receive a number of international students before in our local program. But nowadays, because of the registration a bit strict, then we have less number of international students.
So I guess for international students or rather Malaysians who did their medical training overseas, maybe you can check on the MMC website
Yeah,
for the accredited
yeah.
universities and programs. It's I think the second schedule part of the MMC website, right?
And
Okay, thank you.
fulfill
So,
whatever requirement before the full registrations.
right. Okay. So basically, there's an academic requirement, there's a work-based practice requirement, there's the legal requirement to be practicing as a doctor in Malaysia to fulfill. And then the fourth thing you need to fulfill would be the criteria for scholarships and leave, right, to join the program. So I think these are all the things that we should be looking out for, right, in total. Right. Did I summarize that correctly? Okay,
More or
so
less.
there's a question from Akmal Harun. He says, thank you for the great sharing session. May I know how medical students can prepare to increase the chances for me to be selected for master program later? For example, start journal publication or any other things. Thank you. Says. So
Make sure you perform your housemanship appropriately and in time. And I guess because you would have some interest during your housemanship, what you want to do in your postgraduate session, usually it's like that. So for example, you're interested in medicine, then you would have to prepare. You would have to look up what's the criteria of entry into a internal medicine program. So if you're interested in ONG, then you have to look up what the criteria is to enter. So you can prepare yourself, because sometimes you have to sit for the exam, you have to pass the exam, you still have to continue to study in that particular area. So you have to prepare yourself in that area and make sure that your APC is up to date, you are registrable, don't forget that. And also keep your logbook. It's also very good to keep your logbook, whatever you're doing before, as an evidence that you have done certain things specific to that particular discipline you want to apply.
You know, I think as a Malaysian, please try to help with the real shortage of family medicine specialists that there are, and apply for specialization in family medicine. Think hard, work hard, and join us. What do you say, Prof. Harmi?
Yeah, totally agree with you, Prof.
Yeah. We got to serve our nation first, right?
Yeah.
Yeah.
so
There's a shortage. So people are looking for jobs and looking for family medicine specialization. So your security is, is there. Job security at least. Yeah.
Thank you, Prof. Jamie, Prof. Chandra. And actually, if you look at the various, if I may add, the various specialty colleges website and the various universities, there might be an applicant guide for you to read. And in there, it's already written what is required. So you can use it as a guide, even if you're a medical student or just doing your first posting as a houseman, you can use this guide to build your portfolio, I would say.
Even my suggestion as a houseman, you can start contacting each university, the discipline that you want, so then you know the requirement, you know the people. By knowing the people, then perhaps the chances for you to be selected is higher, because of you already make an early engagement to them, and you by showing your interest, your passion, I think that the strategy that you can use to make sure the yield of your application is higher lah.
Yeah. And you can even become a member of the societies, because we have a student membership sort of thing as well. So you can actually become a member.
I hope that answers your question, Akmal. There's another question from Aiman. If the person is bound to JPA for 5 years service, can the person still apply for the program during the 5 years?
Come again, please. If a person.
if a person is bound to JPA for 5 years of service, can the person still apply for the program during the 5 years? Jamie, I think, would you like to take this?
You should be able to apply even though you're type, because it's what Prof. Hami was saying just now, there's no discrimination. But after you've been accepted, so for example, so if you need scholarship, then you have to find ways how to find that. So even a contract MOs can still get into a postgraduate program, but the question is afterwards. So whether or not he's able to get a scholarship, whether he's paying on his private leave, because this is a clinical internship. You're still working while doing the program. So that's one thing that you need to remember. So it's a clinical internship. There's something he said, this on-job training, it's a specialist training program. But I don't see any reason why you shouldn't be able to apply.
But remember, when you take the HLP, then the bond will be continue after you complete your training, and then there will be another bond for your training, for your training as well, for your specialist training. So the extension years, I'm not sure. Perhaps you can refer to KKM and JPA. Last time 7 years, right? But now I'm not sure the latest one. Any change in terms of the duration of the bonding?
I think the bond, every time a scholarship is offered,
Then,
that's whether or not your
Mm.
previous bond is on hold, or is it you're serving concurrently during the program, or will it continue after you've completed the program? So
Yeah.
so basically, when you do have your scholarship offers, please read the document thoroughly and understand.
Yeah.
But of course, since our aim is serving the nation anyway, and we want to ensure that we build our own capacity, so the bond is actually, you get through it, don't worry. Thank you so much for your questions. So I have a comment from Norman. So he says, in any career progressing process, you need to know three things. The first is to know what, and then know how, and then know who. And he says that he thinks JPA bond will be temporarily paused when you are in a cuti belajar in the program and continue after graduation. But again, I think you should read the contract closely.
Yeah.
while
Sometimes
you're signing.
it changes lah. I'm not sure the latest one. Yeah.
Correct. It does change from time to time. So from KR, he or she, I'm not sure, I'm so sorry, says, thank you very much for the great sharing session. The internship mentioned earlier was actually housemanship and medical officer done overseas. Additionally, they asked if we are going to get a recording. So I think we will post it on the MEMS website. So there will be a link later. So we will announce it on our website. Okay. So Norman says bond works one after another, not in parallel. So yeah, that answers the question earlier on. Okay. Are there any more questions from the members of the floor? From our participants? If not, can I just summarize? So we know that the career pathways are available to us. Today we've explored family medicine as a specialty, and we know that is something that the country desperately needs. So and there are various pathways for us to pursue this depending on our own personal needs and requirements as well. So in thanking our speakers for their insightful sharing. It was very comprehensive and very eye-opening. So thank you, Prof. Jamie, Prof. Chandra, and Prof. Hami. And thank you everyone for joining us today. So can we thank our speakers in the usual manner?
May I quickly promote? There will be more webinar series on medical career pathways. So this is our first event. Thank you for the three speakers, and Dr. Jahan for moderating this session. I just want to quickly take this opportunity to promote our future webinar. It will be 4 events or in total, including this one, and then we'll be having the next one next month. Will be on medical-based pathway. So we will be sharing the this one. Okay, so medicine on October, the next one, and then we're gonna have surgery based in November, on 18th of November, and preclinical, paraclinical, lab-based, and education in December, and then we're gonna have the last one. So these 5 altogether in January. So please watch out the dates, and we'll be sending more flyers related to all these career pathways. Okay, thank you.
Okay, thank you very much.
Thank you very much.
you.
Thank you.
So the recording, we'll put it on the MEMS website, right? So for all those participants who are asking. Alami?
Thank you.
Yeah, we'll be uploading it. Thank you.
Recording stopped.
Thank you very much.
everybody. Thank you
Thank
so
you.
much. Have
Thank
a nice
you.
weekend.
Thank you.
Bye.
Big thank you to everyone.
Thank
Well
you,
done.
everyone. Thank
Thank
you.
you, Dr. Lakshmi. Thank you, Dr.